Today, let's talk about the Varicella zoster virus. This virus is also called as human herpes virus 3. If this virus infects a child, the child gets chickenpox. If this virus infects an adult, the patient lands up getting an infection called zoster or shingles. How do the patient present to you with? What are the clinical features? There will be a lesion which looks like a dewdrop on rose petal appearance. So, how does a lesion look like? Dewdrops on a rose petal. Let me show you the pictures. See, this is the actual picture of a dewdrop. So can you see these water drops, right? And this is a rose petal. Similarly, if you see the patient's lesion, just like the dewdrop, these vesicles are there. Can you see these small vesicles? So these vesicles are called as a dewdrop. And can you see this red lesion surrounding it, right? Erythematous lesion. So this erythema surrounding the vesicle represents the rose petal. All right, see, this is how dewdrops on a rose petal looks like actually. Again, one more picture I have for you. See, this is a vesicle, all right, and around it is the erythema. So this is a dewdrop and this is what, guys? The rose petal. Now let's see how the rash distribution is. Okay, before that, what is the incubation period of chickenpox, guys? It is about 2 to 3 weeks. Okay, now how does a rash appear to be? First thing, it is bilateral, so it affects both the right and left side of the patient. Second thing, remember that it is very diffuse. When I say diffuse, I mean that it is not localized to one area. It occurs all over the body if it starts occurring. Okay, so that is diffuse. The third one, very important, it has centripetal distribution. It has centripetal distribution. So what do you mean by centripetal, guys? It means that the lesions will start on the trunk. Okay, the lesions will start on the trunk. That is called centripetal distribution. Afterwards, from the trunk, the lesions will spread towards the limbs, towards the extremities. Now, when this occurs, it is called as centrifugal spread. Okay, let me tell that once again. The lesions will start appearing on the trunk, and that is called a centripetal distribution. After that, it starts appearing onto the limbs, right? And that is called a centrifugal spread. Another thing that you have to remember here is that the lesions will appear in the form of patches. Okay, so this is the umbilicus, this is the trunk of the patient. The lesions will appear in the form of patches. So there could be one patch here, one patch here. Whenever a patch arises, the patient gets fever, right? If a new patch comes, again the patient gets fever. So with the arrival of new patches, okay, actually in chickenpox we call it crop. Okay, the patch name, we don't say patches, we say crops of lesions. So whenever new crops of lesions occur in the body, the patient gets an episode of fever. All right. In chickenpox have a specific appearance called as pleomorphism, guys. Now what do you mean by pleomorphism, or pleomorphic rash is what we call? Pleo means many. Okay, so it means that in chickenpox the patient gets different kinds of skin lesions. See, this you can see here is an ulcer. Okay, there is a break in the skin epithelium, so this is an ulcer. This is a blister, this is a papule. See, this is a crust formation. So these are different stages of lesions, and all these can be seen in a single patient, right? So that is why we give it the name pleomorphic rash. It's not like only ulcers are seen, it's not like the patient will have only blisters. No, different stages of these lesions can be seen in the same patient simultaneously at the same time, and that is called as pleomorphic rash. What is the period of infectivity in chickenpox? See, once let us take a rash as the central point. 2 days before the rash has arisen and 5 days after the rash has gone, the patient is infective. Okay, remember 2 days before the occurrence of rash and 5 days after the disappearance of rash. Immunity, well, this is a good thing. See, if the patient gets chickenpox once, he has lifelong immunity. Now, who are the reservoirs of chickenpox? It is humans only, right? We can't get it from animals or other sources. Only a human can transfer it to another person. Are there any carriers? Are we known to carry it in our body? No. There are no carriers known. Okay. Chickenpox is actually a self limiting lesion, but sometimes it may lead to complications if not treated. And these are something to worry about. Talking about complications, what is the most common complication that you see in chickenpox? It is secondary bacterial skin infection. That is the most common complication we see in chickenpox. What is the most common extracutaneous complication? So, when I say extracutaneous, it means that it is not related to the skin. What other organ could be involved? It is the CNS. CNS involvement is the most common extracutaneous complication seen in such patients. What is the most common serious complication? See, if this serious complication arises, we have to be extremely careful. Now, what is that serious complication? It is a, no, I wouldn't say it is the most common. What I meant to say is it is the most serious complication. Okay, the most serious complication is varicella pneumonia. It is a lung infection by the virus, especially if that is seen in pregnancy. Then it becomes very difficult to treat. Okay, so let's go with it once more. What is the most common complication seen in chickenpox? It is a secondary bacterial skin infection. Most common extracutaneous complication is what? Other than the skin, what could be involved? It is a CNS. What is the most serious complication? That is, if the lungs get involved, if the patient gets pneumonia due to this virus, it is called varicella pneumonia, and especially if the patient is pregnant, we got to be very careful in treating the patient. Otherwise, it can lead to grave complications. Let's talk about fetal congenital varicella syndrome. What is that, guys? See, this is about mother to child transmission. Let us say a pregnant lady got chickenpox, okay, and she didn't get treated well. If she gives birth to a baby, let's say if she had a normal vaginal delivery, definitely the child is also going to get zoster infection, right? And that leads to fetal congenital varicella syndrome. Remember, in this syndrome, everything becomes small. Okay, everything becomes small. The child gets microcephaly. What is microcephaly? Here, the head becomes very small, right? Then the child gets limb hypoplasia. The limbs of the child can be very small in such a case. Then there could be cicatrical skin lesion. Cicatrical means what, guys? Cicatrical means scar formation. So, if the child gets herpes infection, zoster, the chickenpox, that is from the mother, that is mother to child transmission, child will end up getting fetal congenital varicella syndrome, which is a triad. There could be microcephaly, limb hypoplasia, and cicatrical skin lesion. What if the zoster virus, herpes zoster, infects an adult? That is called as shingles, guys. Okay, or we call it zoster also. Now, why does this occur? See, this is because the pathogenesis is that this adult would have got the herpes zoster infection when he was a child in his younger age, but because of good immunity, he did not show it out, right? But once he crosses the age of 50 years, or let us say 60 years, he becomes old. Okay, his immunity goes down. So what happens to the virus which was latent or sleeping inside his body will show up, and that is called as shingles. So shingles is nothing but the reactivation of the zoster virus in a body. This patient would have got the virus when he was young, but the virus remained inactive because of his good immunity. So it gets activated because of decreased immunity and old age. The rashes in shingles are unilateral. So when I said chickenpox, it is bilateral, remember? But in shingles, okay, this is the umbilicus, this is a trunk that I have drawn. It is unilateral. It can affect either this side or this side. Mostly it is unilateral, but yes, after that it can spread. So it starts as a unilateral lesion. And next point is that it is segmental. When I say segmental, I mean that a particular dermatome is infected. For example, see, when it gets activated, the virus gets activated, it can either infect, it's an example, okay, the thoracic dermatome, or it can affect the sacral dermatome. So a particular dermatome is infected, guys. The third point you have to remember is that the patient complains of lot of pain. So the rashes, I'll show you the pictures. The rashes are unilateral, segmental, and very painful. Let's see some pictures. Can you see? This is a lesion of shingles. Again here. See this? See, this is where the face is affected. The face can also be affected, right? In shingles, and this is how it looks like. Some adults will ignore the rash, and this can lead to complications. The most common complication is the post-hepatic neuralgia. What is the meaning, guys? It means there is pain. Okay, even after the infection subsides, the patient complains of chronic pain. That is why the name post-herpetic neuralgia, because the neurons are affected here in this condition. The virus will attack the neurons, right? That is why there is pain even after the infection subsides. So it is so chronic that you have to give the anesthetic dermal patches to subside to decrease the pain. The other complication is that eyes can be affected. So that condition is called as zoster ophthalmicus. Zoster ophthalmicus. We learn more about this when we take the ophthalmology class. Okay, so just remember that in shingles, the eyes can also be affected, and that is called as zoster ophthalmicus. The third complication, and something that you have to know very important, is called as Ramsay-Hunt syndrome. Now, what is this Ramsay-Hunt syndrome? So I told you that the virus remains latent in our body for long period, right? Where does it remain latent? Suppose it was sleeping inside the geniculate ganglion. What is it, guys? Suppose if it was remaining dormant in the geniculate ganglion, once it gets reactivated, it leads to a condition called as Ramsay-Hunt syndrome. Ramsay-Hunt syndrome is a triad, guys. Okay, triad consists of, first thing, otalgia. Now what is otalgia? It is nothing but ear pain. Okay, then there could be vesicles where in the ear canal. So we say vesicles in the external auditory meatus. EAM, external auditory meatus, is nothing but the outside part of the ear. Okay, then the patient can get facial nerve palsy. So these three things come under Ramsay-Hunt syndrome, which is very important. I repeat, if the virus was latent or was sleeping where? Inside the geniculate ganglion. Once the virus gets activated because of old age or decreased immunity, then this can lead to Ramsay-Hunt syndrome. Finally, let's talk about the treatment. Okay, the treatment, definitely if it is a viral infection, we have to give antivirals, right? Here we give acyclovir. Can I ask you what is the mechanism of action of acyclovir? See, the virus has got DNA, right? And for virus to multiply, the DNA has to multiply. Okay, and DNA multiplies by an enzyme called as DNA polymerase. What does this acyclovir do? It stops or inhibits the DNA polymerase. So can now the virus DNA multiply? No. And that's how the virus is inhibited. Okay, the second option is, usually it's just for your knowledge, okay, it's not very practical. There is a vaccine for chickenpox, okay, but as I mentioned, it's not known to everybody. People may not take it, but just for theoretical purpose, you should know that there is a vaccine for chickenpox. Remember two things about it. It is a live vaccine, and which strain of the varicella zoster we use to make this vaccine? It is the Oka strain. Oka strain of the varicella zoster is used to make this vaccine, and we give 2 doses of this vaccine. Okay. scenario is mother to child transmission. Let's say a pregnant lady got chickenpox. Okay. Now, if she gives birth to the baby, let us say it is a normal vaginal delivery, definitely the baby is also going to get chickenpox, the varicella zoster infection. Suppose the patient was not treated properly, then the baby is also going to get the infection. In such a case, we have to give varicella zoster immunoglobulins to the baby within 94 hours of exposure. When I say immunoglobulins, I hope you all know these are nothing but antibodies, right? So we give varicella zoster immunoglobulins to the baby within 94 hours of exposure to the infection. That's it about varicella zoster. Thank you.